The smell right before your period, it totally sucks because you think you're getting a recurrent infection, but here's really what's going on. You've noticed that this happens, but you have no idea why. Because right before your period, everything starts to smell kind of different, kind of gross. You're wondering if you're having recurrent BV or yeast. And you get your period, and everything kind of smells like your period. And then at the end of your period, you have that like funky odor again. And then boom, you're back to like life is normal. And you keep asking your gynecologist what's going on right before your period every single month. You feel like you have a recurrent infection. Your hormones are at a low leading up to your period because there's no baby to support with all these like big juicy hormones. So when the hormones go, guess what? I mean, besides you feeling like SHIT, what essentially happens is with the loss of estrogen down there temporarily for the month, you've changed the pH, you've changed some of the beneficial environmental things that the hormones normally do to promote lactobacilli, which your inside vaginal tissue needs in order to have its like typical balance. So with that drop in hormone leading up to things, you can have proliferation of the crap bacteria that causes recurrent infections like your yeast and BV. So then they kind of like kick up their amount, but your bleed starts. So that kind of like washes it out a little bit, and you have more of that like period odor as opposed to more of like an infection odor. Blood drops off a few days later, and some of you just kind of linger just enough to let a little bit of bacteria kind of like resume its funky odor before the hormones start to kick back in. Estrogen comes back. It's kind of like the vacuum system of the vagina cleaning stuff up. And when it cleans it up, then you start to smell like you again. So it's not that you get these necessary like recurrent infections that you're causing, it's the hormonal shifts that's causing them. And there's not like a ton of absolute magic in the sense that your hormones have to have these shifts. You could consider a vaginal probiotic just for the sake of promoting the good stuff that kind of blocks out the bad stuff during